If you're like most people, then you probably think of leg cramps as something that just happens when you work out too hard. Or maybe if you sit in one position for too long. But did you know that leg cramps can also be a common problem for the elderly? Actually, around 60% of older adults experience leg cramps at some point, with women being more susceptible than men. And while an occasional cramp may not be cause for alarm, frequent or severe cramps can be a sign of an underlying medical condition. The good news is, there are some simple things that you can do to help ease leg cramps naturally. So stay tuned till the end of this video, because we'll show you how it's done. But before we get started, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button. Thank you. Let's begin. Muscle cramps can be painful and debilitating, especially for the elderly who may already be dealing with other health issues. Cramps typically feel like a tightening or cramping sensation in the muscles, and they can be accompanied by a feeling of weakness or fatigue. In many cases, leg cramps are caused by dehydration or electrolyte imbalance. This is because our muscles need fluids and minerals such as potassium, magnesium, and calcium to function properly. When we don't have enough of these things, our muscles can become overworked and start to cramp up. Another common cause of leg cramps is poor circulation. As we age, our arteries can become narrower, which means that our muscles don't get the blood flow they need. This can happen even if you're well hydrated. It can lead to cramps, especially in the calf muscles. Poor circulation can also be caused by nerve problems, which are common in the elderly. Nerves send signals from the brain to the muscles telling them what to do. When the nerves aren't working properly, the muscles can receive the wrong signals and cramp up. Now, even though leg cramps are usually harmless, they can sometimes be a sign of a more serious condition, such as kidney disease, liver disease, or diabetes. It's important to see a doctor if you experience frequent or severe leg cramps, especially if they're accompanied by other symptoms such as swelling in the legs or ankles, changes in urination, or skin discoloration around the affected area. Your doctor will ask about your symptoms and perform a physical exam. They may also order blood tests, urine tests, or imaging studies to rule out any underlying medical conditions. Now that you know what causes them and how to spot potential problems, let's talk about how to prevent leg cramps in the first place. There are a few simple things you can do to help reduce your risk of developing cramps, and we'll go over them right after this. See, staying hydrated is one of the most important things you can do to prevent dehydration. Drink plenty of water throughout the day, especially before, during, and after exercise. You should also eat a balanced diet rich in fruits and vegetables. These foods are high in potassium, magnesium, and other essential nutrients that help maintain proper muscle function. Another way to reduce your risk of leg cramps is to stretch regularly. Stretching helps improve circulation to the muscles and can prevent them from becoming too tight. Be sure to stretch before exercising, and also consider doing static stretches where you hold a stretch for 30 seconds or longer. Additionally, you might want to try yoga or tai chi, both of which involve slow, controlled movements that can help increase flexibility and reduce muscle tension. Staying active is another very important thing you can do to reduce your risk of leg cramps. Exercise helps improve circulation and strengthens the muscles, which can make them less likely to cramp up. Aim for at least 30 minutes of moderate intensity exercise most days of the week, and remember to warm up before exercising and cool down afterwards. Also, if you smoke, it's important to quit, as smoking restricts blood flow and increases the risk of cramps. So far, we've talked about preventing leg cramps, but what can you do if you or someone you care about already has them? We'll tell you how to deal with cramps shortly. But first, we want to mention that this video is not intended to provide medical advice. If you suspect you may have a medical condition, please consult a physician. Now let's continue. Treating leg cramps usually involves a combination of rest, ice, and over-the-counter pain relievers. For example, you can try applying ice to the affected area for 20 minutes at a time, several times a day. You can also take a warm bath or shower, as heat can help relax the muscles and improve circulation. Gentle massage of the cramped muscles can also help relieve pain and tension. In addition, there are a few specific exercises that can be helpful in treating leg cramps. One is called the Knit 2 chest stretch, which targets the quadriceps muscle in the thigh. To do this exercise, you need to lie on your back with one leg raised and one leg bent. Start by bringing the bent knee towards your chest and hold for 30 seconds. You can also try the towel stretch, which works on the calf muscles in the lower leg. Sit on a chair with your legs extended. Place a towel around the toes of the affected leg and pull it gently towards you. Hold for 30 seconds and repeat several times. These gentle stretches can help improve flexibility and reduce muscle tension. Now, apart from these physical treatments, maintaining a healthy diet can also play a role in alleviating leg cramps. Drinking plenty of water is important, especially during and after exercise. And eating foods high in potassium, magnesium, and calcium can help restore electrolyte balance. You can find these nutrients in foods such as bananas, avocados, spinach, and almonds. It's also important to note that certain medications can contribute to leg cramps. Diuretics, for instance, are often prescribed to treat conditions like high blood pressure and edema. However, they can also cause dehydration and electrolyte imbalance, leading to muscle cramps. If you suspect that a medication is causing your leg cramps, talk to your doctor about adjusting your dosage or switching to a different medication. Finally, it may be helpful to see a physical therapist who can teach you exercises and stretches specifically tailored to your needs. They can also assess your gait and balance to identify any contributing factors, such as muscular imbalances or problems with the way you walk. Physical therapy can be particularly beneficial for the elderly who are at higher risk of falls and other injuries. Leg cramps are common, but they can be eased with some simple self-care measures. Staying hydrated, stretching regularly, and maintaining a healthy diet can go a long way in reducing your risk of experiencing cramps. If you do get cramps, try applying ice, massaging the affected area, and getting plenty of rest. Over-the-counter pain relievers may also help. By taking these steps, you can keep your legs healthy and cramp-free, so you can stay active and enjoy life to the fullest. Now that you know how to deal with leg cramps, you'll want to watch this video on how to avoid falling down and breaking a hip. And if you're caring for an elderly parent or loved one, this next video will teach you how to protect them from dangerous summertime heat.